What are some challenges as a male nurse that I've experienced?
Oh my god! Even does it from. Oh my god!
What's good, YouTube? NWA here, Nurse Pat, coming at you again with some more heat. Got a great question here by this gentleman, basically asking me if I could touch base on some challenges that I've seen being a male nurse. It's a good question. Honestly, I feel like there's more pros and cons as being a male nurse. Some are more obvious than the others, and I'll start off with the obvious ones. When you're a student, you're not gonna get much experience in the OB and L&D areas. Now that's obvious. Why? You're probably gonna get kicked out of the rooms. Most people do not want to see this baby nurse glaring at them when they're having a baby. I mean, if you're not into those areas as much anyways, like myself, it's not that big of a deal. Another obvious one is that it's still somewhat seen as a feminine role. Throughout the years, male nurses have been growing and growing in terms of numbers, but still the vast majority ratio-wise is more female than male. Some patients will refuse male nurses because they're just not comfortable with that. Sometimes they'll be okay with you doing regular stuff and assessments, but when it comes to like bathing or toileting, they don't like that. Totally fine with me. Less work.
It's all good, baby.
Sometimes you'll get patients or maybe even family and friends asking you, how come you didn't become a doctor? How come you didn't become a PA? Oh, but you're gonna go back to school, right? This isn't the end. So again, with the gender roles, they kind of see that nursing isn't somewhere where people, or males I should say, will end up.
That's not good enough!
And that every male wants to be a doctor or a PA. It's a little like as if they're degrading the nursing role and stuff. Lightweight disrespectful, you know? And that's just not what we came into nursing for. We came into nursing for nursing. I could go off on my personal opinion why I chose to be a nurse rather than those two, but that could be another video in the future. Another challenge is that some cultures, they're very protective. So like a husband's very protective over their wife.
They be acting like I'm Mr. Steal Girl or something.
I'm like, yo, I'm like half y'all age, bro. Like, and they're just like overbearing. They'll answer for them. They'll like ask all these questions. They won't want you doing like any assessments, especially like any private areas. And they'll overall just make the decisions for their wives. True story, you know, this happens a lot. I came into a patient's room this one time. Simple procedure, just had a lap cholecystectomy. And, you know, of course, upon my assessment, I'm asking the patient if she has any pain. And she's quiet. Husband looks at me. Oh, she's 8 out of 10.
What?
Oh, I'm sorry. Y'all connected, or you feel her pain? You had the surgery too? Sorry, I didn't say that, but that's exactly what I was thinking. I'm like, I wasn't talking to your ass, you know? Let your damn wife speak. But honestly, that's all I got for you guys. I don't know a whole lot of cons or challenges, in my opinion. At the end of the day, if you want to be a nurse as a male, go for it. If you're passionate about it, you feel like it's your calling, why not? It's a great profession, well respected in general, and you'll be having so many benefits from it. If you haven't seen my first video talking about the truth about being a male nurse, go ahead and check that out over there. If you're feeling the content, do not forget to comment, like, and subscribe. And as always, stay safe, stay humble. I'm out.